Thank you. Here I am again. Now you're going to have to wait a little while before your exercise break. So start wiggling your toes in preparation. I want to really thank Bert and Jessie and Ethan and Pauline, because they have really set the scene for what I want to say, and I'm really grateful to them. I want to talk about practice out there, about dietitians and their practice. So here we go. Oh, first slide. My research has been very much in energy balance, and I'm really comfortable with this slide, and I suspect you are as well, because it's got the things that we're familiar with. It's got numbers, it's got months, it's got a reference at the bottom, hurrah! And this is even better, it's got columns of information and statistics. I'm comfortable with this. I don't know if I'm so comfortable with this. And Jessie just hit it on the nail. The first time I went into practice, having learned all my theory, got all my columns and statistics lined up, and I had to talk about tablespoons of peas, ooh, that was a real shock. Because suddenly I realized why I had been studying. And so I want to introduce you to Mrs. M. She's an 81-year-old widow. She lives independently, but she's had a fractured hip. And she gets physiotherapy, which causes her tiredness. She really doesn't feel like eating because she's tired and she's miserable, she's lost weight, and she needs something to cheer her up and build her up, because she's also got problems in her mouth. She doesn't really like what you've provided, which is protein and energy drinks, but fortunately when she goes home she will have plenty of support. And her prognosis is good. Okay, where do your columns, your statistics, and all those papers you've read fit in to Mrs. M? And as Pauline was saying, they don't easily fit. So we got to learn what to do with Mrs. M. And it gets worse, because it's not just Mrs. M. Anyone could walk through your door. Anyone. Grief. Do they all have different requirements? I'm afraid they do. They all have different lifestyles, and everyone is unique. Help. Okay, this is you in university, yeah? You remember that diagram? Okay? And here is your tutor, and here you are, and the tutor is saying, good work so far, but I think we need just a little more detail right here. And that's what your clinical practice teaches you. It's that detail. Because I suspect you may pray for a miracle, but actually as a professional, no, with evidence-based practice, you don't get miracles, you get actual planned intervention. Dietetics is evidence-based. Remember, Mrs. M? We don't want miracles, please, Mrs. M. We would like to know what to do with you. And that's what practice is about. You need to be competent, but it's more than just knowledge. It's more than skills that we've picked up in the food lab. It involves the ability to meet complex demands, drawing on and mobilizing all your psychological resources, skills, attitudes, in where you are at that particular time. Because you may see Mrs. M in the hospital, you may see her in the community centre, you may see her in her home. So everything is different. The ability to communicate is absolutely critical, and it draws on all sorts of things: your practical skills, your attitudes, and your knowledge. This is the competency statements in Italian. Sorry, I didn't get them in Romanian, but I know that they're there. I showed you this slide yesterday. Where are we going to test accepting personal responsibility and accountability for your dietetic actions? We can only test it in the real life situation. How can we test works within the limitations of your knowledge? You've got to be in that situation. So you have got to demonstrate this in practice. Must be demonstrated in action. Practical training, practical experience is essential. Now, when we did our survey of competencies, we divided them into responses by the dietitians, the employers, and responses by the academics, the HEIs. And it was very interesting. This is the ranking. Notice what the employers want. They want you to be lifelong learners. Just as Ethan said, working what your next 5 years is going to do is really important for employers to know that you are progressing, keeping up to speed, anticipating the market demands. Legal, ethical information. What do your academics want? Well, guess what? They want to know you can apply the knowledge you taught them, that you have a knowledge of the profession, that you have general knowledge in the field of study. Isn't that interesting? Different priorities, knowledge, but actually what the employers want is your practical abilities, your ability to think in action, apply the evidence. So why is there a difference? Well, I was thinking about this. Competence is difficult to teach, that application, and it's difficult to measure. Not impossible, but difficult. Knowledge is easy to teach and measure. I bet you're good at writing examinations. Both can be done through thoroughly training your teachers, your supervisors, and using the right tools of assessment in each situation. Now, when we did our work in Diets 1, we collected information on what practice teachers and lecturers said about placements. And I thought this was an interesting one. Lecturers and teachers work together. Some lecturers teach in placement, and they may even work in the placement. And the supervision plus evaluation, it can be done by different professionals. One of the positive aspects of our placement training is good cooperation between lecturers and trainers, because they work in the same hospital and are able to harmonize teaching and assessment. Wow, isn't that great? And placement supervisors and university staff will work together with students, evaluate problems, take care of patients, and have discussions. Teachers moving from the university as dietitians into practice. Great team working, great harmonization. And here's a few more. You can look all of these up. There are lots of them. Right, placements are about 12 weeks to allow students to follow up their patients. Now that's important to see if you've actually achieved anything. Really important. Practice placement training during the first, second, and third semesters. And on well-chosen periods, students independently carry out consultations. In each case, 2 students and the placement teacher are with the patient. First, the discussion of the results takes place, then one student leads the consultation, and the second student listens. Isn't that great? All this working together, because you can feed back to each other. And afterwards, there's a post-discussion of the consultation. And in the third semester, dialysis patients, a patient is consulted more than 3 months by one student. It's a long time, but they have consultation and they can follow up their patients. The way to go. Not days, not hours, but weeks. Because weeks allow you to look at Applying the competencies in different contexts with different people, really important to demonstrate that you can do that. What are dietitians around Europe saying that students should be able to do at the end of their placements? And therefore, what do they want to help you achieve? Translating research of scientific knowledge into the appropriate language that people can understand. Acquire the skills of data gathering and analysis, evidence-based practice, theory into action, adapting to the environment and how and who to approach, working independently, but recognizing their own limitations, and self-confidence. I love the way Jessie talked about being competent and confident. Absolutely. Now, this is what dietitians said they wanted to help their students to do. This is what they said is important if you are going to be a practicing dietitian. So isn't that wonderful? They've got your best interests at heart, and they will do everything they can to help you achieve that. The standards, the competencies that we've set are there to help. They're there because then the dietitian practitioner can assess at the end whether they've been achieved. Now, we recommend 1,000 hours, but in our work previously, we became very aware that most practices in Europe are around about the 600 hours mark. So they're not up to 1,000. Some are slightly below, but most of them are around about the 600-hour mark. Remember, we need to go on testing. Just because you walk out of the door, just because you do your last exam, doesn't mean you've finished. You've got to keep on. Being competent should be linked to continuing ability and registration, or certification, or being licensed to be a dietitian. We think it's unethical to practice with old-fashioned, out-of-date evidence and ideas. Should be linked. And we've got some specialist competencies on their way. Okay, how do we look? How do dietitians look? Now, this is the work of dietitians telling us how do they evaluate performance. And I've pulled out just a couple of them. They look at reflective reports assessed by lecturers and the dietitians. The students are questioned by the practice placement trainer, and students are observed performing the activities by the placement trainer. And they often have a tick list. Have they done this? Have they done that? Have they done that? These are just some. You can see there are lots of ways of assessing students. So that evidence is there, and it's in the reports that we've published. Here's an example of a competence reflecting on knowledge, and then we've suggested how you might. Don't look at the red dot. There it is. Can you see it? Just about. Yeah. That's how you might test whether that has been achieved. So there are performance indicators. Professional relationships and partnerships is also a key competence. To be able to maintain a relationship, to practice client-centered care, and meet the client's expectations. What do you do, as Jessie said, if somebody says, I don't want that, but you know that that is not the best solution? You have to respect their understanding. Now, I want to just give you a little flavor of some research that we've been doing at Plymouth. This is my colleague, Tracy Parkin. And she's interested in those relationships between the client and the dietitian. So I want to share just a few of her results. First of all, she says that relationship is built upon such things as, are we being motivational to the person? Do we appear enthusiastic? Do we actually motivate the person? Do we think about where they are in their cycle of change, ready to move on, ready to change their behavior? What might determine how we approach that situation? And how do we set goals? Lots and lots of research out there, mainly on doctors, who are not always very good at this either, and nurses, and a few on dietitians. So, how do we test? How do we know whether we're communicating effectively? Because if we are, then we may in fact have a success for effective practice. So training courses are helpful. But many say, oh, well, I've been using this technique for years, why do I need to go on a training course? Well, how do you know it works? Perception doesn't necessarily equal reality, and again, we've got research on that. Practice nurses trained in patient-centered care think they're doing it, but actually they're not. Perception data does not correlate with reality. You have to check, and that's what Tracy did. So she looked at what was going on with the patient and the professional in that consultation and whether or not it produced an outcome. Suppose we've got Mrs. M back. Was it Mrs. M or Mrs. B? I can't remember. Anyway, terrible, terrible. First rule, never forget your patient's name. Anyway, there she is with me, and I've forgotten you, how do you do, who are you, yes, and the consultation. Do we get agreement? In other words, during that consultation, I may make some suggestions, she may make some suggestions, and we may agree on some decisions. So, you agree? That may happen. Look at me. Are you agreeing that will happen? In a consultation, you may make some decisions, they may make some decisions, and you might agree on those decisions. I trust you're with me. So what Tracy did was she tape recorded 86 dietetic consultations, and then she asked them, as the patient and the dietitian finished, please can you write down any decisions that were made in the consultation today? Immediately after the consultation, she asked them to do that. Now, what do you think? They should hopefully agree, perhaps, maybe? Okay, so here we're looking at what the patient wrote down, what the dietitian wrote down, and what actually was recorded on the tape. Right. Patient decisions that agreed with the tape. 159 agreed with the tape. The dietitians scored a bit higher, 219. Decisions on the tape that the patient did not recall. 162 decisions the patient didn't recall. 102 that the dietitian didn't recall. Now suppose the dietitian wrote down decisions on her card that didn't match what the patient thought and decided. When the patient comes back and the dietitian says, oh, how are you getting on? Have you done blah, blah, blah? And he thinks, I don't remember agreeing to that. Okay, could be a problem. So, just because you think you recall what was said, you may not. And that's important because you've got to be in sync with your client. You've got to agree. Communications are core. If you can't get the communications right, you're stuck. It's an essential skill. And there are differences between the consultation with agreement and those consultations with disagreement. And yes, it is to do with the way the dietitian approaches the interview. But you'll have to wait for the paper, which is written and being submitted before I let you know what those differences are. But you can do something about them. Level of agreement on recall of decisions. So, this is now the end product. One dietitian and patient agreed on one decision as they left the interview. One. Not a great number, is it? Well, we're getting a bit better. Second dietitian, about 1.5 decisions they agreed on. Third dietitian, 2 decisions. And the fourth dietitian, just under 2. Now, what do you think those numbers mean? 1, 5, 6, and 3. What do you think they mean? Huh? Shall I tell you what they mean? Okay. That's the number of courses that those dietitians had been on. Can you see a relationship? CPD, this dietitian had only been on 1 course over the past 10 years. See what happens? Look at these. Okay? Evidence. Courses are important. Continuing professional development helps you. So stop and ask questions. Look at the results. Listen. And you cannot do this except in practice. Okay, so are we still relying on miracles? Do not expect miracles. It's certainly not professional, and it's not very scientific either. We just need a little bit more detail, more evidence, more training, more help, more support. Reflective practice, marvelous. Stop, listen, think. Identify skills, review practice. Complacency is our enemy. Okay, I'm just going to whiz through because I know you're itching to do some exercise. I get a little bit of exercise up here, but I know you're itching. I thought this was so fascinating. This again is from report number 2, all on the website, lots of information. This is on practice placement learning. The activities undertaken on placements in 2008 and 2009, where N is equal to the number of HEIs reporting. Now, across Europe, practice placements are done differently. Most have at least a first and a second placement, but some have first, second, third, and fourth placement. And you'll see that only 7 HEIs out of 31 do all 4. Now, it doesn't really matter that you do 4, it's the time scale that I'm interested in, how long you spend in placement. Right, so first of all, let them observe a dietitian at work. Yep, 77% of respondents said on their first placement we do that. Second placement, 71%, yeah. Third placement, 80%. But wait a minute, aren't you getting better? Aha, you do get better, because by the fourth placement, where's my little light gone? Well, you can see it, there you go. It's going down a bit, because by this time you should be out there being rather good at being a dietitian. Explain how the student should do the task. 74, 75, 93, wow, what's going on there? 83%. Okay, so as the tasks get more complicated, you still need explanation. Let the student counsel the patients alone. Well, you wouldn't expect much going on in the first placement because you're so new to it all. By the second placement, longer time scale, 46% let students counsel patients on their own, 47% in the third, and by the fourth placement, after a period of time, 100% of the students were being allowed to counsel the patients completely on their own. Reflected diary. Well, yeah, reflected diary is being kept. Ask the student to reflect. Ask the students to prepare a case study. Only 42% on the first placement, 50% on the second, 80% by the third, and 100% engagement by the last placement. And then this is interesting. Assign a student full control of a ward. Not as many as Jessie had, hundreds of patients, but just one ward. And, right, quite right, they're not competent at this stage, getting better, a little bit better. But look, half the dietitians, students in the fourth placement were given a ward to look after. And then ask the student to develop a treatment plan. 45, 58, 73, 100%. So what does this tell you? As the length of the placement goes on, you improve, and at the end you are working more or less as a qualified dietitian, still under supervision, still checking, but at least it demonstrates that there is progression. What do we need to do to evaluate practice? Undertake audit, reflect, and Pauline's talked a lot about that. Message for teachers, in case teachers amongst us are getting worried, help is at hand. The Diet's website, the network partners have posted all sorts of good information on the website. And there are consultative committee reports, there are booklets, guidelines, information, and all sorts of things to help you think about how you're going to assess students. So, dietetics is complicated. Science and art. Practitioners need to be able to change the behavior, not just of their clients, but sometimes the people looking after them, sometimes other healthcare colleagues, sometimes your managers and your policymakers. Dietitians need to be competent in using all those skills and applying them in different situations. But above all, it is a teaching and education profession. I sincerely believe that. And I'm going to use the word hands-on in a different context from the one Jessie used. By hands-on, I mean we don't do physical hands-on the patient. We sit facing, with, talking to, and therefore the only thing that we have at our disposal is our voice, our body language, and we need to make connections that way. So, all of these people we need to connect with. They may all have a nutritional area they need support, and that is the only thing that you can really learn how to do on placement. Thank you.